how the enteric nervous system, the second brain in the gut, and our central nervous system, first brain, how they connect is through the vagus nerve. It is the connection point. It is literally the phone line between the gut and the brain. So when we talk about that gut-brain axis, the vagus nerve is the key to building that axis up to allow for the brain to connect with the gut and the gut to connect to the brain. This is how the microbiome speaks to the brain. This is how we are able to send information up as to what's truly happening within the gut and the rest of these organs. 80% of the information that is on the vagus nerve is not going from the brain down to those organs. It's coming from those organs and going up to the brain. 80% is afferent information from the organs to the brain.
Today's guest is Dr. Navaz Habib, and he is the best-selling author of Activate Your Vagus Nerve, as well as Upgrade Your Vagus Nerve. He's the host of the Health Upgrade podcast. After graduating as class valedictorian from the Canadian Memorial Chiropractic College in 2010, he went on to practice traditional chiropractic for years until he utilized the power of functional medicine to transform his own health. Dr. Habib is the founder of Health Upgraded, an online functional health consulting clinic, supporting optimal health by elevating the awareness and function of the vagus nerve. So happy to welcome you today. Welcome to Take Back Your Health. Well, welcome, Dr. Navaz. Navaz, did I say that right?
You did.
I'm so excited to have you here. You are the author of Upgrade Your Vagus Nerve. You also have another book just about your vagus nerve, but this is the one that I have. And so today we are going to be talking all about the vagus nerve. And this is something that I personally need help with. And I think many, many people out there. So before we dive in, do you mind just, giving into IFM, how'd you get into functional medicine? And then how did the vagus nerve become kind of your core topic and expertise?
Yeah, it's a great question. My entire story starts a long time ago. I always was very sciencey in school. I always was very interested in biology and anatomy. It always really stuck out as the thing that I was interested in. And even in high school, I remember doing projects and building a model of a brain and being really interested in the cranial nerves and noticing that the vagus nerve was unique at that time. It was the only cranial nerve that left the head cavity. It was the only one that connected to essentially every organ within our body. It just was something that stuck out, but I didn't really pay a lot of attention early on. I went to chiropractic college, and when I was at chiropractic college, I weighed 250 pounds. I had high blood pressure. I was borderline diabetic. And on a 5'7" frame, that weight obviously was not great. So I was dealing with a lot of metabolic issues and challenges, and I didn't really understand what I was doing to myself. I didn't truly understand the negative impact that my habits and my lifestyle were having on my ability to function optimally. When I graduated from chiropractic college, met my wife, and we had this moment of Zen where we said, okay, we need to really plug down. And if we want to have kids, we don't want them to have to deal with the health challenges that we're dealing with. Let's do something about this now so that we can really positively impact the lives of our children. And through the next couple of years, I became interested in and introduced to the idea of functional medicine. And it actually came from a gentleman, I think, who you know quite well, which is Sachin Patel. He randomly met me at the chiropractic clinic that I was working at. It was a very chance encounter, but it was amazing because it helped to really provide some really top-end, high-level information as to what functional medicine was, what health truly was, what it meant to be healthy, and provide me with the opportunity to look into what functional medicine was. And a big part of that initial functional medicine journey that I went on started with Google searches, started with doing some work in understanding on the social media side who was talking about these things. And you were actually a big part of my journey. I remember seeing your books popping up. I remember watching a lot of your videos and whatnot on YouTube. And it was something that was very important to me. So when I saw you at IFM, I said I had to come and say hi to you because it was a really interesting moment. And I just needed to share that with you. So thank you for being a part of my journey.
Now, were you already a chiropractor at this point? And were you practicing, now we know, as, I'm trained as an MD, but there are these chiropractors, and DOs, and they have a broader training in many of what some people would call alternative medicine, or what we, functional medicine. So were you already sort of exposed to this? Were you doing, did you have a sort of a traditional chiropractic practice, or were you incorporating anything?
I had a traditional chiropractic practice. I was working hands-on with clients. I was learning a lot of what it meant to be a practitioner with patients to help them get through their health challenges. And it was during that time, once I was actually practicing, I was about 3 or 4 years into practice, where functional medicine became kind of this forefront moment for me.
So you were kind of probably realizing you were having limited tools in your toolbox.
Very much so. And it really was the frustration of having my patients come back every week with the same issues and not having resolution, not having the tools or the desire to really get rid of their challenge. They just wanted maintenance care. And I thought, I'm not helping these people. I'm seeing them every week for the same things. I'm doing my acupuncture. I'm getting them adjusted. I'm doing soft tissue therapy. I'm giving them exercises, and yet they're not improving. They're still they're having short-term symptomatic
relief. Yeah.
But they're not getting better. I'm not helping them to the level that I want to. I want to be able to work with somebody for a period of time, get them better, and then have them go out the door and go and sing praises and live their lives and come back whenever they need something every so often. But I don't want them to be coming in for symptomatic relief. I just found that was not the type of medicine or chiropractic care that I wanted to provide. And functional allowed for me to shift into a much more lifestyle-based practice, a much more supportive practice. And it helped to support my health on this journey as well. I ended up losing a good chunk of that weight. I ended up getting rid of a lot of these diagnoses that I had been borderline at experiencing. And this was my journey. And a big part of that journey, and you mentioned, or you asked about the vagus nerve, how I thought kind of the vagus nerve would come in, was in early 2000s, the idea of the cholinergic anti-inflammatory pathway became a general knowledge, or it came up through the scientific mediums of the world. And what we started to realize was the vagus nerve is the pathway by which this inflammatory control actually takes place within the body. It's the role of the vagus nerve to send signals to control inflammation throughout the entirety of the body. This links a lot to autoimmunity. So what you talk a lot about, the concepts that you bring up in the forefront, I'm talking about just one level deeper, understanding that it's the inflammatory control that we've often lost that then result in the conditions that people are then diagnosed with or are dealing with.
Okay, so trained as a chiropractor, not satisfied with everything, had your own personal health struggles, and then moved into functional medicine. And for those that aren't familiar, why don't we just tell them what the vagus nerve is? I mean, I feel like it's one of those buzzwords now. Yes. You and I were just talking about our vagus nerve stimulators. So I feel like it's, really something that's coming to the forefront in functional medicine, maybe even in medicine in general. But for those that aren't familiar, why don't you just tell us, about the vagus nerve, what it is, what it does, where it is in our body?
I'm going to start with something that's a bit of a misnomer. We often say the vagus nerve. In reality, there's two. We have one on each side of the body. They come out at the brainstem, and they're the 10th cranial nerve. So we have 12 pairs of cranial nerves, and it's the 10th of the 12 pairs, meaning that it's coming out at a very important point in the neck at the medulla oblongata. And there's certain connections to the brain, obviously, and then the nerve then goes down. It passes through the neck, literally adjacent to the carotid artery and the jugular vein. So if you go and you find your pulse in your neck, you're actually within a few millimeters of your vagus nerve. So that's an important factor. It stays within the carotid sheath, which should give us a little bit of indication just how important the vagus nerve truly is. The carotid sheath is a small soft tissue protective barrier that contains the carotid artery, which is the blood vessel that brings blood to the brain, the jugular vein, which brings blood from the brain back to the heart, and the vagus nerve. That's it. Just the three things. And there's one on each side. That nerve then goes down. It wraps around the esophagus. It comes down around the trachea, goes to the heart, goes to the lungs, essentially every organ within thorax, but it continues on down through the diaphragm and goes into the abdomen, where it connects to virtually every single organ in our gut, particularly the small intestine, stomach, liver, pancreas, gallbladder, kidneys, you name it, and then indirectly to the spleen. But we can get into that otherwise. This is the only nerve in the body that does this. The right and the left will come together, and it goes and it connects to essentially every single organ in the body. That's so unique to this one nerve. And that's why it always stuck out as being something that I was really interested in, because it didn't run like every other nerve in the body. It's not a nerve that's going to tell my bicep to contract. It's not a nerve that's going to send a signal of simple sensory information up to the brain, just like the vast majority of nerves. This one was unique, and that's what stuck out.
And it's actually a pretty big nerve. I mean, we had to do dissection in medical school, and I remember, it's like, we found the vagus nerve, and it's, I mean, you would probably be able to tell us better, but I mean, not quite as big as our pinky, but it's pretty big. So has a vital role, and I certainly had never thought about it, as being in the bundle with the carotid artery and so, yes, I mean, that is, I mean, I remember that dissection, but I hadn't really thought about it all being bundled there together to keep it protected and how important it is.
Absolutely.
Is that one of the reasons that, they say that like the gut is the second brain? Is it because of this innervation? Sort
of because of this innervation. We've got the enteric nervous system, which is basically what we call the second brain, which is the nerves and the nerve endings within the lining of the small and large intestine, right? So these nerves are necessary for regulation of peristaltic motion, of movement of food along the intestinal tract, the absorption of and regulation of nutrients through the gut lining, as well as maintaining the barrier. But how the enteric nervous system, the second brain in the gut, and our central nervous system, first brain, how they connect is through the vagus nerve. It is the connection point. It is literally the phone line between the gut and the brain. So when we talk about that gut-brain axis, the vagus nerve is the key to building that axis up to allow for the brain to connect with the gut and the gut to connect to the brain. This is how the microbiome speaks to the brain. This is how we are able to send information up as to what's truly happening within the gut and the rest of these organs. And in fact, 80% of the information that is on the vagus nerve is not going from the brain down to those organs. It's coming from those organs and going up to the brain. 80% is afferent information from the organs to the brain.
So can you dive a little deeper into that? I mean, what's the significance of that?
Yeah, this is where we're getting all of the status information as to the function of each organ up to the brain to tell the brain what's happening in these visceral organs. Are we absorbing enough nutrients? How leaky is the gut? Is the gut incredibly leaky, or is it not at all? Do we have a good, strong barrier? Is there the presence of inflammatory toxins coming in through the gut? Things like lipopolysaccharide, things like potentially gluten that's triggering a breakdown in the gut lining, right? What are the potential triggers? What is the inflammatory function? What is the immune system doing in each of those organs, and getting that information up to the brain? And if we don't have that information effectively being passed up to the brain, then we don't have a good status update as to what the inflammatory or immune system function is in each of these organs. And I think we have a bit of a misnomer as to what the immune system does. Yes, it protects us from threats to our survival, but that's not it. It also is heavily involved in maintaining and keeping a good, strong function of each of those organs. Not to forget this entire concept of building those organs. The tissue-resident macrophages are the main innate immune cell that are present in every organ of the body, and they're there to help to get your brain or get those organs built and function when we're in development, and then to maintain their function through our old age.
If there's some inflammation going on, or, in terms of, the gut, leaky gut, and these signals are going up to the brain, and then what is the brain doing? Because it's not like, any one of us can say, oh, my gut is leaky, or, oh, I have inflammation in this tissue. So we're not cognizant of this. So what exactly is happening when these messages get to the brain?
There's a lot of processing occurring up in the limbic brain, particularly. So in the reptilian brain, the brain that's been there, that doesn't provide conscious function, it's more of the subconscious. That's where a lot of that processing of this information occurs. So we have this information coming up into the brainstem. It relays up into a bunch of different nuclei and different structures within the central nervous system, but the majority of those are present in the reptilian brain. That said, if you've ever noticed your gut is a little off, you're not feeling so hot, something is wrong, or there's some sort of dysfunction that's occurring in your gut and you feel that, that is your vagus nerve having information being sent up through it in a very important function called interoception, where we almost get to sense what's happening if there's optimal or less than optimal function, suboptimal function in the gut or in any of these organs. So you can always, if you have a meal that obviously causes some gastrointestinal discomfort, you're going to notice something is a little off, or you can, that sense of, I just don't feel right. Something just doesn't feel right today. That is often what we're experiencing, but that is part of the information that's coming up through the vagus nerve. Then that processing that occurs, that's primarily occurring within kind of the reptilian or the limbic subconscious brain system. But that information is being relayed to the hypothalamus. That information is being relayed to the thalamus. So the hypothalamus is going to be involved in hormonal production and hormone execution. So the HPA axis or the HPT axis, right? Or even the gonadal axis, getting that information to the hypothalamus for it to then be relayed as to, do we need more cortisol? Do we need more thyroid hormone? Do we need a little bit more of the specific relay hormones to go out to send signals for optimal function to occur, or to counteract any inflammatory thing that might be occurring? Then that information is further processed, and then it's sent down through efferent pathways, which is about 15% of the information on the vagus nerve. And this is what we traditionally call the parasympathetic kind of relay system. And this is the effective system. So this is turning on what's called the rest, digest, and recover system. So that 15% is going to send information to help slow down our heart rate, to help slow down our breathing, to help put us into a state where digestion is effectively going to occur. So it's sending signals to the enteric nervous system to get your relay system of your gut working so that you can actually digest the nutrients from your food. We can't heal or we can't digest our food when we're in a sympathetic fight or flight state. We can only do so when the vagus nerve is on and we're in a parasympathetic rest, digest, recover system. And I know I've kind of glossed over this sympathetic, parasympathetic, what this means, but we have a lot of automatic processes that occur within our body, things that we don't consciously need to think about that are taking place all the time. And these subconscious functions are processed through a system called the autonomic nervous system. And the autonomic nervous system has two branches. We've got the sympathetic, which is the fight or flight system, and we've got the parasympathetic, which is the rest, digest, and I've added recover system. And the vagus nerve sends that parasympathetic information out to the rest of the body. That information is required in order for us to enter a healing state, in order for us to digest food, and for us to go into a state where our body can rest and recover. That's a requirement.
You had mentioned earlier that the vagus nerve was really part of the immune system, which I don't think there are actually a lot of people talking about that. So I find that, very interesting. And, in reading your book, it was saying, we can get what I think people are familiar with the word dysregulation, right? Where we have too much of the fight or flight versus, I don't really know anybody that has too much of the rest and digest and recover, but they might be out there, the Dalai Lama or, somebody who's, Joe Dispenza meditating all the time. But I think most of us, or at least most of my patients that I saw, because I was seeing people with autoimmunity and chronic diseases, are, kind of stuck in the fight or flight. Or if not stuck there, then they definitely have a dysregulation or an imbalance. So can you explain to us, how that is influencing, chronic inflammation, and why you're saying, you've touched on it in terms of the vagus nerve being part of the immune system. So, what relation does the vagus nerve have for chronic inflammation? Because so many people out there, I'm sure that you're seeing in your clinic, certainly that I saw in mine, are dealing with some sort of chronic inflammation, somehow.
The immune system is there to protect, maintain, and build us. But when there are too many triggers that can cause it to go into an hyperactivated state, that leads to inflammation. And if that inflammation is not controlled for a long period of time, that leads to what we call chronic inflammation. Acute inflammation is a good and necessary tool, but we need to be able to push the brakes. So the simple analogy that I can provide here is, think of a car. Your car has an accelerator and it has brakes. The accelerator is a requirement for the car to be functional and for it to do what it needs to do, right? A car is a piece of junk. If the accelerator and the engine don't work, you're not going to be able to get anywhere. It's sitting in your garage and you're kind of stuck. Whereas a car that's moving but doesn't have brakes is actually a danger. And that's what we need to avoid. When the brakes are not working and the accelerator is not working, it's a very rare consideration. It doesn't really occur. More often than not, just like you're seeing, we have people that have their foot on the gas and they're trying to push the brake and nothing's happening. They're trying to push their body into that parasympathetic rest, digest, recover system, and they're just not capable. And it's often because that brake line, the vagus nerve, is either cut or broken down or dysfunctional. And it's stress that causes this, but not just stress in the way that we think about stress. We often think of stress as the day-to-day kind of rigors of psychology, of family stressors, of dealing with the kids, of financial challenges, whatever the stressor is for you in your day-to-day life. That's one category of stress. We also have to look at psychological stressors. What happened to you as a kid? Did you ever experience potentially childhood trauma? Did you ever have a situation where you were the victim of a crime? Or did you ever have any challenge that caused you to have a traumatic incident of psychological imbalance that occurred in your life? That's a second area. So was there an incident that scuffed the lens through which you see the world, and thus your perspective has been changed? And that's a big number here. Perspective is a really big, important thing to look at. There's two other areas that we often overlook. Where functional medicine really thrives is biochemical. Biochemical stress and sources of biochemical stress is incredibly overlooked in modern day-to-day medicine that isn't looking at a holistic view. When we look with a holistic view, we understand that we're living in a chemical soup. We're living in a situation where our microbiomes are under attack. We're living in this situation where there's dysregulation or dysbiosis of the microbiome, excessive levels of sugars, of pesticides and herbicides sprayed on our foods. There's all these toxins that are entering the body. I believe the number was 302 some odd chemicals found in placental blood at this point, right? We're living in a chemical soup. And these are biochemical stressors that are causing a lot of challenge, that are attacking our bodies. But we can also look at, are we getting enough of the good nutrients that need to be coming in? Are we getting enough protein and amino acids? Are we getting good quality fats? Are we getting reasonable carbohydrates or fibers that help to support that gut microbiome? What about electrolytes? Do we have enough of the salts, of the sodium and potassium balance that needs to occur to maintain optimal pH and optimal balance of our blood? Right? Are we getting all of those things in that we need to? And are we avoiding the biochemical stressors that can knock us down? So that's the third area, is biochemical. The fourth is physical stressors. Physical stressors is something that I, as a chiropractor, worked on a lot with my patients. And this is where we get to ask the question, did you ever have an injury? Did you ever have a slip and fall type of injury? Did you have a car accident? Physical injuries? Were forceps used during birth? Right? There's a lot of these potential physical injuries that we can experience, as well as on the opposite side of this, sedentary lifestyles, where we're just not moving enough, where our bodies are being told that when we're not moving, we're under stress. And that new stressor of not moving enough is really taking hold of our society. So we've got these 4 areas that really need to be looked at, understood, and identifying the root causes of these stressors in those 4 areas. Because each one of those areas is going to slowly fill up the bucket of stress capacity that we have. And as that bucket gets full, we go to a point where our bodies can no longer handle it. And the vagus nerve function in those situations will decrease over time. And that's what's cutting that brake line. That's what's not allowing the vagus nerve to send those signals to regulate the immune system function. And that then is what leads to chronicity of inflammation, or allowing inflammation to become long-term chronic, because the brakes just are no longer working and your car is on the accelerator on go.
So when you say cut, we don't mean physically cut. I mean, there are some cases in which the vagus nerve gets cut, and I'd really be fascinated to know what the implications of that are. But what you're saying is that your body's really not recognizing, the break. And so that was daily stressors, psychological stressors, physical stressors, and biochemical stressors, just to count that. So before we get into what we can do about it, because that's what I always like to help people with, what would be some signs and symptoms? How does somebody know I think people, know they're stressed, but how do they know if they're really dampening that parasympathetic and vagal nerve tone and response? What would be some signs in their life that, that this is them?
It's a really great question. And understanding how you feel is where you're going to be able to then pinpoint if vagus nerve is involved. And in most situations where there's a chronic symptomatic inflammatory condition involved, the vagus nerve has some level of involvement for sure. What we need to look for are a few important things. Number one, what's your heart rate? What's your resting heart rate? Okay. If you are lucky enough to have things like wearable devices that are out there, whether it's a watch, a ring, a chest strap, whatever these options are, use these tools to understand where you're currently standing. If your heart rate is elevated, if its resting heart rate is over a 70 beats per minute number, you can guess, or you can extrapolate from that you are not able to bring your resting heart rate into an optimal zone, which is that 50 to 65 range. That's where you want to be most of the time, unless you're an endurance athlete and you're probably sitting at 37 or something like that, which in that situation is totally fine. But we want to, for the general public, be in that 50 to 65, 50 to 70 zone for beats per minute. Anything higher than that is a sign that we're not able to bring the heart rate down. And that is one of the roles of the vagus nerve. So knowing what your heart rate looks like, that's a really important one. If you are easily startled, if you're dealing with a level of anxiety off of something very small, or you're very jumpy, this is another sign that you're easily pushed into that sympathetic state. Fight or flight is activated quickly, and you don't have a very simple function of bringing back to the parasympathetic rest, digest, recover. And that's where we want to be most of the time. We want to spend about 80% of our time in that parasympathetic rest, digest, and recover state. The unfortunate situation there, day-to-day life right now, most people are the exact opposite. We're sitting 50 to 70, 80% in that stressed zone.
The hard thing is, I tend to be extremes in many things, and so like if I am when I'm in parasympathetic, I almost find it hard to get things done.
Yeah.
So what kind of, I don't want to derail you from giving us the signs and symptoms of having a vagus nerve issue. So if you want to pause and answer this afterwards, but how is that because I've just been in fight or flight for so long? But how do people who are in that much parasympathetic get things done?
We released a podcast episode today, which I think is very relevant.
Okay.
And
remind us the name of your podcast.
It is the Health Upgrade Podcast.
Okay.
And myself and my co-host, JP Erico, who's the developer of the vagus nerve stimulator, I'll tell you.
Oh, okay.
The two of us had a discussion on autonomic function and its role in decision making and who makes the best decisions. And there was a a very important kind of example that he gave, and this is that superstar athletes are able to make the best decisions even when they're in the most parasympathetic mode. They're able to stay parasympathetically centered in that rest, digest, recovered state to make the best decisions, even under situations of high stress. So he used this analogy of NFL players that were put onto a treadmill to go as hard as they possibly can, get to their 90% of their maximum heart rate. And then they were asked questions about what they would do in certain situations during the game. And they said across the board with near 100% accuracy, the best decisions were made by the players who were able to maintain their heart rate at a lower level. They were able to push themselves into this parasympathetic zone more readily. When you say that, and this is not an uncommon thing for me to hear, honestly. I see this.
Yeah, I mean, I think making a decision and getting things done are different things. I mean, because that just goes along with, opening your heart center and listening to your gut, versus your brain. That makes sense to me in decision making.
I think you're really good at that. I think you have this ability, and nobody writes multiple books without the ability to regulate where they're at and make good decisions, but also act on them. There are moments where we need to push the accelerator, right? The car doesn't move by a thought. You have to push the accelerator to go. You have to go into sympathetic to be able to function, but you need to be able to pull yourself back into parasympathetic when the need is there. And so that's what these moments are, is can I pause the doing for a moment to think effectively and then act on that? And so how quickly can I go back and forth between the accelerator and the brakes? And so it's not a dimmer, it's more of a dimmer switch type of situation. It's not a flick on and off. We want to be able to regulate slightly downwards when we need to think, and then slightly upwards when it's time to move. And so you get stuff done, and most people will only get stuff done when they're in that sympathetic state. But if we just slightly dim it, bring it down ever so slightly, right? It's not a 2-option thing. We're not a binary function here. We're on a very much a sliding scale. So if we're able to bring it down ever so slightly, just to be able to think about something for a moment and then be able to then accelerate and go, that's what we want to create. So the ability to go down and up easily and have a good clean slide of that dimmer switch, that's what we're looking for.
Okay. And you're going to tell us how to do that after we finish. Okay. So looking at your heart rate, and you ideally want it, between 50 and 65 at resting. And I imagine lower at night. When you say resting, you mean sitting here, not doing something actively. And then, I'm sorry, I'm already heart rate. And then
there's one more that I'll add in if you're already using a wearable device that you can add this onto, which is heart rate variability.
Yes. And what I love in your book is don't compare your HRV to anybody else. So I love that because yes, I've looked at others and sort of wondered about mine, although mine has improved dramatically over the years as I've been trying.
I've had a lot of people that have tried different devices where they've had a ring on, like an Oura ring or something on their finger, and then they've had a Whoop band or a Fitbit or something on their wrist, and the numbers are completely different, and it's just within the same person.
Oh, okay. All right.
And then on top of that, person to person, very different. There's a lot of variables that allow some people to be in the hundreds and some people that are in the 30s, and that's their normal. That's okay.
Yes, but let's get into it. I mean, heart rate variability is the variability between your heartbeats, and the higher the number,
the better it is.
The more resilience, the more reserve you have.
Exactly.
And I imagine the more parasympathetic you have as well.
And that's exactly what it's a measure of. Heart rate variability is a measure of how much are you pushing the accelerator versus the brakes. It's a very dynamic variable. And this is actually telling us about that dimmer switch. So when we're in a more sympathetic zone where the dimmer switch is at the top and the lights are bright, our heart rate variability will be quite low relatively on the scale of who we are. When we are in a very parasympathetic zone, our HRV goes up. So as the dimmer switch comes down, HRV goes up. What this is telling us is that our bodies are more resilient. We have good signaling coming in from the accelerator to the heart to push the heart rate up, and we have good signals from the parasympathetics, from the vagus nerve, to the heart to bring the heart rate down. And what that creates is increased variability. So the number of milliseconds between beats of the heart successively over a period of time, minimum you need is about 3 minutes to really get a good accurate number of what your HRV is at a certain time. And from that, you can extrapolate, am I more in the sympathetic or more in the parasympathetic zone? And if I'm more parasympathetic, it means I'm more resilient. I'm more capable of handling stress. My body is able to send signals effectively through the vagus nerve. The tone of the vagus nerve is higher. And that means that I can handle stressors better during this time versus if your HRV is very low, it means you're in a sympathetic zone and your body is not able to handle the stressors as effectively. That's what we are using HRV as.
I imagine that the bands that some people do during exercise, and maybe they just, wear them around, I don't know, that those bands are probably the most accurate because it's right by your heartbeat.
Chest straps?
Yeah, the chest straps.
Exactly. So what we found is when it's a device that's on a finger or a wrist, we're not measuring the heart, we're measuring the pulse. So there's a little bit of a variation from there. So this is actually pulse rate variability that we're measuring. For me, I'm using an Oura ring right now.
Me too.
I'm actually measuring pulse rate variability. But those chest straps, so these Polar H10 chest straps that link to certain apps, those are, of the wearable devices, those are the top of the line because they're actually measuring electrical activity within the heart.
What have you seen? Have you seen that with the Oura or anything that's measuring the pulse rate variability versus the heart rate? Do you find that when you then look at the Polar or, one of the heart rate variability monitors, that I guess, nothing to Oura, but the Oura, do you notice that that's lower or higher than what it would be with a chest strap? Have you
I'll say the
compared them?
variability, not HRV variability, but in terms of the accuracy of the number that shows up, the further you get from the heart, generally the lower it is. But they're all very good. It depends on the eyes with which.
Right. I mean, who wants to wear a strap to bed? I mean,
Exactly.
This is a, piece of jewelry. This is super, but that was a selfish question because if, I'm going to go then put on, because I have one of those, I'm going to put it on and just see if it just gives me a little more confidence that maybe my HRV is actually higher than it is, which would make me feel really good. So that was a selfish question. Of course,
the accuracy of these are anywhere between 85 and 95%. So they're very, very close to an actual EKG, which is the gold standard. So they're not far off. But we never want to use the data that we have on the Oura Ring as diagnostic data. We want to use it as trend data.
Yeah.
We want to know what the trends are. We want to know, am I trending upwards? Am I trending downwards? The number is not an absolute. And we should never utilize that number in a diagnostic criteria. We should absolutely utilize it to ensure that we have trend data to know, okay, for the last week, I haven't been sleeping well. My HRV is really low. This makes a lot of sense, right? We're able to pull these things together. And that's a great trend point. That's what we can use wearable devices for.
Yeah. I mean, I love it. I mean, generally it matches obviously how I'm feeling, but I see that, I'm more easy to cry. I'm more easy to lose my fuse, when my heart rate variability is lower, and then that of course leads to an overall lower readiness score as well. So, I mean, for me, it's always just kind of like a confirmation, but as I have actively for years now been trying to get my HRV up, it is really helpful. And to see that, my average is way better than it used to be. And yes, I have days where it's like, oh my God, this was amazing. And I have days where I know where I was really stressed and, it wasn't as amazing. So I think, I know some of the things that I did to help bring up, now that we're talking about the vagus nerve, but, we're using HRV as sort of the measurement of how well our vagus nerve is functioning. So, I know some of the things that I did to help bring up my HRV. I'm kind of curious, the things that you recommend to people. One of the things I did was heart math and really, doing the breaths. And, I think some people can get overwhelmed or turned off by feedback. I'm a person that, as long as it's generally pretty good feedback, and it was not good feedback in the beginning with heart math. And so, I really had to work at it. And so, yeah, I like feedback and I like devices and programs and apps and things like that. But you
did the work. You said it. And what that means is HeartMath is a wonderful tool. I think it's one of the best out there. It's the greatest biofeedback tool with real-time testing and real-time answers as to where you're currently standing, if you will do the work. And I've had a lot of challenges getting people to commit to the 10 to 15 minutes daily practice of getting that going. But if you want to get better and you really want to improve your HRV and you really want to learn how to adjust your biology through your breath, through your heart rate, and your heart rate variability, HeartMath is an amazing tool, I will say, with a very high degree of confidence.
And they now have, I have back the old school, clip it onto your ear, which they have an upgraded one, and then you use your finger on the camera. So that's interesting. And Aura now has a function, or it's been there for a while, where you can. I just did a week of Joe Dispenza meditation in Dallas a couple of weeks ago, and there's a function within the Aura now that you can put it on meditation, and it will track your HRV. I mean, I kind of wish it did that all the time. That it was, I was speaking to a woman who was from another country. And so she had something similar to an Aura, but it wasn't that. And so she had an app and she was like, oh, yours doesn't measure HRV all the time, continuously. I mean, maybe that's a good thing in some cases. I said, no, I mean, I have to put it in this, in this particular setting. And then if you are walking around or something, it doesn't pick it up, because if you have any hand movement.
Movement is an issue, yes.
Yeah. Okay. Well, what do you recommend that for your patients to help improve their HRV and hence improve the, sympathetic, parasympathetic balance?
The number one thing, without a doubt, and this is the simplest, easiest thing for anybody to do, is to learn to breathe properly. Most people don't breathe correctly. We're often breathing too much. We're breathing through the wrong tube and we're using the wrong muscles. So number one, we want to breathe through our nose. Mm-hmm. Our nose is our breathing tube and our mouth is our eating tube. And lucky enough, we have a backup if we need it. But we should not be using our mouth as our primary breathing tube, because we have nose hairs that filter the air. We have the sinuses, which hydrate and warm the air. And the air then makes its way down into the lungs, prepared and ready to be properly absorbed. The oxygen can get pulled in and the air is relatively clean. When we breathe through our mouth, we don't have that opportunity. There's no nose hairs in our mouth, so the air is coming in unfiltered. We don't have the ability to hydrate that air or humidify that air effectively, and it can be straining to the lungs. So we want to breathe through our nose, number one. Number two, we want
I'm a proponent of taping your mouth at night.
Yes,
I tape my mouth at night.
Mouth taping is one of my favorite tools. It's something I've used for years. It was a huge part of my entire journey and getting over a lot of my health struggles as well. So mouth taping, even with the small piece of just basic 3M micropore tape, nothing.
Yeah, that's what I use, the blue tape.
Exactly.
I mean, people, just listeners, you get on Amazon and they're going to be charging you 4 times as much for some special, mouth tape, the 3M blue tape. I tried to get the generic from Target or Walmart once, and it was terrible. So get the 3M.
And the moisture wicking, or the one that doesn't have an issue with moisture. Because if you drool a little bit, it'll probably come off. So you want something that has a reasonable amount of stickiness, but it's not something you don't need to tape across your mouth. You don't need to go up and down. It can just be like a small, I make a joke that it's almost the size of your Hitler mustache over just the center of your mouth.
Yeah.
Right? So that's a reasonable amount of, some people can, whatever works for you. You don't have to go full. So mouth taping is wonderful. The second thing we want to do is we want to breathe, not with our chest, we want to breathe with our diaphragm. So it has to be belly breathing. We need to learn to use our diaphragm really effectively. Our diaphragm is the muscle that's between the lungs, the chest area, the thorax, and the abdomen. It separates it. And this is a large muscle that when we contract it effectively, it creates the vacuum in the lungs to suck in air, and that allows for us to actually inhale. The other thing that's happening when we have the diaphragm actually contract is it's actually causing motion and massaging motion within the organs below the diaphragm. We often think of just the diaphragm doing the job of creating the vacuum within the lungs, but right underneath your diaphragm is your stomach and your intestines and your liver and your spleen. They're all right there. And the motion pattern that's created when the diaphragm contracts and relaxes actually creates motion pattern within the abdominal organs. That's huge. That's what helps to promote this idea when we're breathing with our diaphragm, that the enteric nervous system turn on, that we go into a peristaltic motion, that we detoxify and pump out the toxins from our liver into the bile and get that out of our body. These things need to happen. That motion pattern that is not occurring when we don't breathe with our diaphragm, we're then not getting these motion patterns occurring within the abdominal organs. So diaphragmatic breathing is key. Belly breathing. So an easy test to see how you're doing, if we put one hand on our chest, one hand on our belly, and we take 3 deep breaths and just assess, do we have more motion in the hand that's on our chest or a hand that's on our belly? And ideally, it should be the hand that's on the belly. And this will be very calming. As you learn to do this and you increase, as you inhale, you should feel an expansion in the hand that's on the belly and minimal on the chest until the end of the breath. And as you exhale, we should feel that the belly hand kind of going back in. So expand with inhalation and contract with exhalation.
You have a couple of different ways to start training yourself doing that, with the 4-4-4 breath, yes. Or, I think it was 4-6-8. Yeah, 4-7-8. Yeah. So can you walk us through those?
Sure. So the 4-4-4.
Are we supposed to sort of be holding our breath in and on the inhale and exhale naturally?
Breath holds can be very helpful, but that's where box breathing does really well. So box breathing is 4 second in, 4 second hold, 4 second out, 4 second hold. That's a great way to help slow your breath rate down, but it doesn't create a difference between inhale and exhale. And this is really cool because when we inhale shorter and exhale longer, we're actually creating increases in our HRV. The reason for this is as we inhale, our heart rate goes up. We're actually sending sympathetic signals to our heart to increase the heart rate. So our HRV goes down as we inhale. But as we exhale, we're sending signals through the vagus nerve to actually create a slowing or lengthening of the interbeat intervals. So we're slowing the heart rate down. When we have increased levels of this variability, that leads to a higher HRV. So short inhale, long exhale is the best way to support this through a very important pathway that creates your HRV, which is known as respiratory sinus arrhythmia, RSA, all right? When we do this effectively, this leads to an increase in HRV. So longer exhales is the key. So the 3 things when we're doing our breath that's going to make our big changes occur is nasal, diaphragmatic, longer exhales.
You do speak about holding your breath, yes. And, not doing that unless you're under, doctor's supervision. But you actually don't even give any guidelines of are we talking 30 seconds? Are we talking 4 minutes? I imagine there's individuality in all of that as there is with anything, but just kind of a rough estimate. I guess First backing up, can you, tell our listeners what I'm referring to from your book and then, how one would do that under the guidance of a physician?
I'm a big fan of testing what's called your BOLT score, BOLT. So BOLT stands for Body Oxygen Level Test. And this is something that I learned from Patrick McKeon and the Oxygen Advantage. I would highly recommend looking into this. But what it's doing is it's teaching your body to handle higher levels of CO2 as your body holds its breath. As you hold your breath, your body is going to create an increased level of CO2 within it, and our oxygen levels are going to go down. And our bodies don't breathe to get oxygen. They breathe to get rid of CO2. CO2 is the defining feature. So how much carbon dioxide is building up in your body is going to be the deciding feature. If we don't have a lot of capacity, that means we have a very low tolerance to higher levels of CO2. That means we have a low CO2 tolerance. That means we're not efficient breathers. Efficiency of breathing comes from being able to hold your breath for a longer period of time and not feeling what we call air hungry, not feeling like you need to gasp to get rid of that CO2 and get oxygen back in. So testing your BOLT score involves you doing a couple of normal breaths, then holding your breath and starting a timer at the exact same time to see how long you can hold that breath without involuntarily needing to take the next breath. So that first feeling of the urgency of taking a breath, that is your BOLT score in number of seconds. the longer your Bolt score, the more efficient you're breathing, the more CO2 tolerance you have, the more carbon dioxide you're able to handle within your system. So what we want is we want your Bolt score to be over 30 seconds. Okay. You shouldn't have an urgency to breathe until after that 30-second mark. Most people are sitting in kind of the 20 to 25-second mark. And if you're in that 25-second mark, you're not bad. But if you're below 20, you're having real challenges getting carbon dioxide levels up. And so you need to train your body. And so this is where breath hold training can come in really effectively. So the lower you are, you shouldn't obviously be holding your breath for 4 minutes then. We should be doing breath holds for 15, 20, 30 seconds, building up slowly to the point where you feel then comfortable holding your breath for 25 to 30 seconds, building it up so that your Bolt score goes up. And so checking your Bolt score on a weekly basis is one of the best ways to know where you stand and if your CO2 tolerance is increasing. This is a tool that I think is entirely underutilized. It's entirely free. All you need is a timer, and that's really, really easy to use.
Even if you are in that 30 or above range, do you still recommend people still try to increase it?
40 plus is the goal for optimal health. Yeah.
Okay.
And that means that your breathing efficiency is at its absolute highest. If you can get to 40 seconds without the first need for that breath. Breath hold training can be done through kind of the dive reflex, right? So when we go into water, when we put our face in water, we go into something called the mammalian dive reflex. And that actually teaches our body to handle a longer period of time where we don't need to breathe. We can go up to this 3-4 minute mark with really proper training. But this is a reflex that creates a lower level of CO2 and a lower turnover of oxygen to CO2 as we go, but it's entirely dependent on training to do so.
And what was the book again that you mentioned?
The Oxygen Advantage by Patrick McKeon.
And then do you see difference in people who live at altitude versus sea level?
Absolutely. So if you're living at altitude, say you're living in Colorado or you're at the top of the mountain somewhere, you're absolutely going to have an improved cardiovascular training regimen. So when you come down to sea level, you're almost in like a hyperbaric oxygen chamber because the level of oxygen there is significantly higher. So if you have the ability to, training at altitude is one of the best ways to improve your cardiovascular capacity and your CO2 tolerance and to breathe effectively at lower levels of oxygen. So teaching yourself to handle lower levels of oxygen and increase levels of CO2. So altitude training is one of those options. I know there's a gym here. I live in Toronto. There's a gym not far from where I live that one of my buddies goes to every day because his work is around the corner. And it's they've changed the oxygen level inside so that you're almost at a 7,000 foot altitude. So the oxygen level is lower. So when you train in that situation, you're then teaching yourself to handle lower levels of oxygen.
Our house in Santa Fe is at 7,500 feet. And then when I go back to Austin, my team is always like, do you just feel amazing? It's like, honestly, I don't really notice anything, but you know.
I would love for you to test that to see how long you can hold your breath in Santa Fe and how long you hold your breath in Austin.
I will do it.
That would be really cool.
I will definitely do it. Have you seen any difference? I mean, I imagine once somebody gets used to the altitude, perhaps there is no difference, but a difference in heart rate variability at those at altitude versus...
Very good question. I think there's too many variables on an individual basis to be able to identify that, but it wouldn't surprise me if there was a trend to higher HRV and higher altitudes.
Another question back to the HRV that I forgot to ask. I had read somewhere that, you know, again, just on average, those with an HRV or average HRV, I guess less than 25, really can be, you know, lead you to illness, that you really wanted at least over 25 to ward off illness. Is that, have you heard that before? Is that something?
There is a lot of correlation to lower HRV levels, generally in that 10 to 20 mark. If you're sitting in that area, the amount of chronic disease, chronic inflammatory challenge in those situations is significantly higher. So why I like wearable devices is it tells you when you get down to that point, and then it teaches you to help to get out of that. I love wearable devices as empowerment tools to help you overcome these challenges and to become aware of them before challenges even take place. But if you're already in a situation, get to know where you're at maybe get a wearable device. I think it's absolutely worth the investment. And it'll then provide you a pathway and empowerment forward as to how to get better from here on out.
Okay, so we talked about improving our vagus nerve, and we can see that by checking our heart rate variability and things that we can do to improve that. Our heart math, there's an app. You can go to the heart math app. You can just use your finger on your iPhone. You can purchase a little clip that goes on your ear, which I personally have. I think that's, when I'm meditating, I don't want to have to, be thinking, is my finger still touching the camera? Or, a lot of times I just like to turn off my phone so that I don't have Wi-Fi or any distraction. Then we talked about definitely having our exhale longer than our inhale. And you have some suggestions in your book, your upgraded vagus nerve, about some various breathing exercises to begin to train your body to start to do that. But we definitely want to be belly breathing. And then know your Bolt score and work to improve your ability to hang on to your CO2. And really in all of these cases, other than in your heart rate, you want these numbers to be high. If the numbers are low, we're having problems. And with your heart rate, we want it to be, lower versus high. All right. Well, anything that you feel like we have not covered? Let's see. I have a question here as I'm looking at how the fact that I didn't use any of these questions, but that there is one, how might the vagus nerve dysfunction be contributing to long COVID? I think there'll be a lot of listeners interested in this question.
There is definitely a strong link to long COVID. In fact, what we're finding when it comes to COVID and how it works, the mechanism of action is that it shuts down or decreases vagus nerve function. So there's a very strong correlation to low HRV and long COVID symptoms. Long COVID is just chronic diffuse inflammation, particularly lungs, and it goes to obviously all the other organs. When it comes to long COVID, there are some really interesting studies showing vagus nerve stimulation as actually being very, very positive, very supportive of overcoming that long COVID type symptom. Long COVID is almost like a fibromyalgia, chronic fatigue, but post-viral, post-infectious. Mm-hmm. And what we're trying to do is lower the inflammatory burden. When the vagus nerve is not signaling effectively, we're not getting those anti-inflammatory signals to the immune cells. And those immune cells are on high alert. So in the microglia, they're hyperactivated. And so they're breaking down your neurons, and that leads to the brain fogginess. When they're in the lungs, it's the alveolar macrophages, and those are lighting up, and we're not getting good deep breaths because we're just inflamed within the lungs. All of the macrophages need to get this signal from the vagus nerve of the vagus nerve neurotransmitter called acetylcholine. When acetylcholine is not being sent effectively because the vagus nerve is broken down and the brakes are not working, what we're then getting is literal dysfunction or destruction of that signaling pathway. And so the immune system cells get hyperactivated. And so in a situation of long COVID, those immune cells are on high alert, and they're sending out inflammatory cytokines like crazy. And they're not getting that signal of acetylcholine to shut that inflammatory signal down. So working on the vagus nerve, all the exercises plus vagus nerve stimulation, which I think we missed talking.
I literally was just going to say, as soon as you were done with this, I was like, wait a minute. We didn't even talk about the vagus nerve stimulators.
Exactly.
Okay. Well, let's dive into that about, in terms of our healing modalities to get us back in balance. Again, you and I were talking, and it sounds like one of your colleagues has invented one of these.
Yes.
And they seem to be, all over the internet these days, these vagus nerve stimulators. So first, can you tell us what they are and do they work?
Number one, yes, they absolutely work. The science behind it has been tested for about 15, 17 years now. And these devices, I can say with a very high degree of confidence, when I recommend it to one of my patients, I see a result 80 to 90% of the time within a couple of weeks. It's pretty phenomenal what we're able to get. So these devices are going to, there's the option of doing auricular vagus nerve stimulation and cervical vagus nerve stimulation. So there's a small branch of the vagus nerve that goes to the auricle of the ear, just on the outside here. So the skin area here, that's where auricular acupuncture works on the vagus nerve, and that's why it's so powerful. But there's a very small number of fibers of the vagus nerve that go to the ear. That said, it still does have an effect, but often takes longer to make the effect work. Where, if you remember, I mentioned going to the carotid artery, going to the pulse, that's where we get the vast majority and the closest to all of the vagus nerve fibers. So we've got it on both sides, right and left. There's more fibers on the right side, weirdly, about almost doubled, 200,000 on the right, but 120,000 on the left, which is kind of a cool, I wasn't there when he designed it type of situation. I don't know why, but we're still trying to figure that out. But what we can do is electrically stimulate that area. And so the science behind this is unmissable. Literally, we take a device like this guy. This is the Truvaga. This is the plus version. And what we do is we put some electrode gel on it. We turn the device on. We put it onto an area just over where you feel your pulse. And you let the electrical stimulation run for 2 minutes. There's an app that comes with it. Just turn the device up on the app and it will go to a point where this signal will occur. And so for 2 minutes, you're getting a bit of a contractile function here. It's not a TENS unit. It's a very unique signal pattern. It's a sine wave that has been shown and been tested amongst a bunch of different frequencies to actually get the best effect in the vagus nerve directly. And so 2 minute stimulation of the vagus nerve here has been shown and has phenomenal evidence as to improvements. It's currently FDA cleared for migraine, cluster headache, hemicrania continua. It's been used in asthma for acute breathing issues. I did have an emergency use authorization during COVID for breathing issues, which was a really cool kind of side tool. It's recently been given the full go on PTSD, which is huge, especially in the VA. Obviously, we have a lot of these veterans that are dealing with PTSD type symptoms. This is a phenomenal tool to help overcome these challenges. Psychology and vagus nerve stress plays a huge role here. And then I've seen it help everything from Parkinson's disease to diabetes to autoimmunity. I've seen it across the board. It's pretty cool.
Do you do it 2 minutes a day? Do you do it multiple times throughout the day, depending on, your sympathetic, parasympathetic balance? Yeah. Are there any contraindications? And then with it being so close to your carotid artery, is there anything that we need to be aware of?
The safety profile of this is pretty phenomenal. There's no issues with regards to releasing of plaques or calcification within the carotid artery. We've not heard a single situation of that sort. The only contraindication is if you have metal in your neck, fusion or some sort of metal implant in the neck, then obviously we don't want an electrical signal going through them. So that's the only real contraindication. It hasn't been tested in pregnancy and postpartum situations, so we want to be a little bit more conscious of that. It hasn't been tested clinically. I can tell you from a few cases.
I was going to say,
powerful and very
the only thing I could imagine is helping that baby come into the world a little more parasympathetic than sympathetic. So, I understand how you have to say those things.
Exactly. Okay. The last thing is, in terms of dosage, there is a dose-dependent response. There was recently an article that came out in Nature showing that the cervical version, not the auricular version, increased your cognitive function, your language learning ability by 25 to 40%. So you actually learn a language 25% faster. So this was a dose-dependent response as well. But what I want to point out here is 2 minute stimulation is what is kind of required as a single thing, but I recommend it 2 2-minute stimulations daily. One in the morning, one in the evening is kind of the simplest thing to add in. Keep it on your bedside or keep it by your sink and do it 2 minutes in the morning, 2 minutes in the evening, and use it as time to breathe and get into that calm parasympathetic state. And if you have a situation, like I spoke to a patient this morning who has gastroparesis, we're doing 2 to 4 minutes prior to each meal to get the stimulation going and getting that going in the acute situation, and then slowly weaning that down or bringing that back to kind of 2 minutes before only. That's the type of situation that I would be using it. But again, each person's going to be a little bit different. It's individual.
And I know you said that you have seen, success or improvement within, a couple of weeks. and certainly everyone's an individual. Are we talking, 2 points on average of your HRV? Are we talking 10 points on average? Are we talking 30 points? Like what are we talking?
The funny thing is there's no direct evidence of HRV changes, which is crazy. Yeah,
okay.
It's not a direct HRV marker, but what we're finding is significant improvements in sleep, in feeling subjectively calmer, of thinking clearer, and that then results over time in improvements in HRV on average. But it's not going to generally, like some people do see it on, if they're doing an Aura Ring unguided session and they do this and then they're seeing that it goes up by 4 to 10 milliseconds on average over that period. But again, we need to be really aware that it's not a direct HRV change that you're going to see.
Right. Well, good to clarify.
Yes.
Well, this was so interesting. I'm looking forward to learning more about the stimulator there, and anybody that's interested in your book. And tell us where people can find you. I know you're located in Toronto, but how can people find you on the web?
Yeah, you can find me on Instagram, Dr. Navaz Habib. And if you just go to healthupgraded.com, you can learn more about us, what we do. I'm in the process of finishing up a course on upgrading your vagus nerve and how to kind of go through it in a DIY fashion. So that will be up in the next month or so. Really excited to have that done.
Awesome. And I totally forgot to ask you, what are 3 things you would recommend our listeners do to take back their health?
Number 1, take control of your breath. Understand that breathing is the key to all of this. Number 2, go outdoors. Like, get some sunlight, get some fresh air. If you've ever felt stuffed up being indoors, just go out, get some sunlight, get some fresh air. It changes everything. And number 3, move just a little bit more than you were used to, because we're sedentary, we're living in a convenient life. We need to be moving a lot more. Those 3 things I think are going to change everyone's health for the better if you do them.
Awesome. Well, thanks so much. Great to chat with you, and I appreciate you coming on the show.
My absolute pleasure. Thanks for having me.
I want to thank this week's guests for sharing their time and knowledge, and thank you for listening. To read the full show notes for each episode, which include a summary, timestamp, quotes, and any resources mentioned, please visit amymyersmd.com/podcast. Lastly, if you've enjoyed this episode, I'd love if you would leave a rating and a review on Apple or Spotify, and we'll select a few to read out loud in a future episode. Tune in next week to hear from another inspiring guest as we help you take back your health.